Hi everybody, my name is Dr. Jamie Marich, and I'm the founder and director of Mindful Ohio and the Institute for Creative Mindfulness. I'd like to take a few moments here on this video to go through some of the ins and outs of registering for your basic training in EMDR therapy. It's not lost on me how confusing this process can be, especially if you're new to this whole EMDR world, this whole EMDR scene, and you're checking out some of your options for being trained. Our program here at the Institute for Creative Mindfulness meets requirements for the EMDR-IA, or the EMDR International Association standards for a training program in EMDR therapy. Although our curriculum is very mindfulness informed and we do our best to infuse our love of mindfulness into the training of the EMDR content, please know that over the course of our two-part training and the supplementary consultation, you will be meeting the requirements set by the EMDR International Association for 20 hours of lecture, 20 hours of practicum, and 10 hours of consultation. How these hours get split up can vary from program to program. So if you have been checking out other training programs in EMDR therapy from other providers on their sites, it may seem different to how we do it. So that's a major reason that I wanted to put this video together. Although we've done our best to explain it as clearly as possible in the pages of our website, we do get a lot of questions asking for certain procedures to be clarified. So as I mentioned, to meet the EMDR-IA or EMDRIA standards for a basic training or full training in EMDR therapy, 20 hours of lecture, 20 hours of practicum, and 10 hours of consultation have to be met. In our particular curriculum, we split these trainings up into two parts for our public trainings. A Part 1 training consisting of the first 3 days covering approximately 20 hours of content, and then a Part 2 training, which many people choose to schedule at various intervals past their Part 1 training. So that's the first common question that we often get. How far apart should I schedule my Part 1 training from my Part 2 training? It really depends on you. We schedule trainings in cities at least 4 to 6 months apart from each other. So for instance, if you're interested in a training in Columbus, Ohio, and you may take the Part 1, let's say in a certain month, typically we will have a complimentary training in Columbus scheduled anywhere from 4 to 6 months later. Now, although many people choose to wait that 4 to 6 months, if you see a training that we offer scheduled in another city closer to the time of your Part 1, we certainly do not forbid you taking the Part 2 training closer to the time of your Part 1. Please know that according to EMDRIA standards that we're now asked to follow, you have up to 2 years from the time that you registered from your Part 1 to complete the Part 2. So although we don't recommend waiting that long, know that if life gets in the way or you're in a situation where you need to wait because of continuing education or funding requirements, you do have up to 2 years to complete the Part 2, although we've had many different trainees complete their Part 2 training in a very close period of time to their Part 1. It really does depend on you and their learning style. So to complete the requirements, Part 1, Part 2, and then 10 hours of supplementary consultation. And this is where a lot of people can get confused because training programs choose to handle this 10-hour consultation program differently. So we allow you to spread your 10 hours of consultation out throughout the course of your personal training program. So if you take Part 1 and Part 2, let's say 4 to 6 months apart, which is what we generally recommend for most, we do suggest that you complete about 4 hours of your consultation in between the Part 1 and Part 2, and then the other 6 or so after the Part 2. Now some people split it up differently, and that's something we really advocate in this program, is giving you the choice of how you split up your hours. So you may choose to do 6 to 8, let's say, of your consultation hours in between the Part 1 and the Part 2, and only, let's say, 2 to 4 afterwards. Now some people don't do any between the Part 1 and Part 2, which we definitely do not recommend, but if for some reason life should get in the way and you have to take your Part 1 and Part 2 without doing the consultation in between, we do let you take all 10 hours afterwards. So here's a part that is a trip up, a step up for a lot of people orienting themselves to our program. The cost of the consultation is not included in either the Part 1 or the Part 2 training. Most of our trainees have stated a preference to engage in this pay-as-you-go model. So doing the Part 1, the Part 2, and then paying for your consultation as you go really represents our version of a payment plan that a lot of our trainees are interested in, this pay-as-you-go model. So how consultation is booked and paid for is we have several different consultants working in our team right now. You can go to the consultation tab underneath the EMDR training on the website and see the various consultants that we have working in our program. So our consultants charge different rates. Some of our consultants offer individual consultation, some offer group consultation, and at the basic training level, you are allowed to do a mixture of all of them. You can do all 10 of your hours in group format, which is a cost savings. If you know that you work better one-on-one with that more direct consultation or instruction, you may choose to do all 10 of your hours individual format. So the main reason we don't include the cost of consultation in our fees is that we have found different trainees have different needs when it comes to consultation, and it really is our way of allowing you to flex what you spend. So a big warning that we want to give for those of you who are maybe having a agency or an employer pay for your training is to make sure that you work in the cost of the consultation into any funds that you may be requesting for training, because the consultation does come at an additional fee. But to talk about some of the flex spending that we can offer here with the consultation, please also be advised that we have several consultant trainees who are working in our program. They also appear under our consultation tab. Our trainees are all working under my supervision, and they all again are able to offer the same consultation that we do. They're just still not carriers of the full approved consultant credential yet through EMDR, but they're working on that. So we let you complete up to 4 of your 10 required hours with a consultant trainee, and that could come at a tremendous savings to you. Also, peruse through the different consultants, look at bios, see what resonates, look at the consultants that offer groups, and you may find that doing group format consultation will definitely work at a savings for you. So that is a little bit of how the process works. Again, to summarize, a Part 1 training, a Part 2 training, 10 hours of consultation that you can schedule throughout the course of your training with any of our consultants that may resonate with you. To restate, they charge different fees, and this is a way that we give you a chance to kind of flex what you spend based on your needs, based on maybe their experience that may resonate with you, and we also give you that option to look at individual versus group. So conceivably, you can complete all 10 of your consultation hours for as little as, let's say, $200, and on the higher end of that, you could end up spending over $800 to $1,000 for your consultation, just depending on who you want to work with and in what format. The group format is definitely permissible. It's what most of our trainees end up doing to keep the cost of their training low while still getting that good quality, but we do fundamentally want to leave it up to you in our program. So that is why we have that feature in place. Please be advised that at this time we do not have a lump sum pricing. We may be introducing this at some point down the road where you can pay for Part 1, Part 2 and your consultation all together. But right now we have found that most of our trainees like this pay-as-you-go format, because we often get the questions, well, do you have a payment plan? And the short answer is not officially, but this is the way that we essentially offer a payment plan by allowing you to pay as you go. So I hope that's clear. If it's not, please send us a question or a comment on our contact form, which appears on the website. So another common question that we get is, why do the trainings have slightly different costs, city to city or part to part? Couple different reasons for that. First of all, we let many of our faculty members work as autonomous contractors. So for example, our faculty who's based in Los Angeles, California, although he works in our approved curriculum, does run his own training and registration, and several of our other faculty members work in that model as well. And they are setting prices based on the cost that it takes them to run the trainings in their respective cities. You may notice on the Ohio trainings that if you take your Part 1 in Cortland, Ohio, which is where Amber and I are based, that's where we are able to offer you a pretty substantial discount because it is at our home facility and our home base and travel costs aren't involved. So we try to keep the prices in the same general range that hopefully you see as a good deal compared to some other EMDR trainings out there, but know that sometimes because of facility costs and locational costs with traveling to different cities, we do vary the prices slightly. That's just a choice that we have elected to make in order to pass some small savings where we can on to you. You're still welcome to view our video resources page of this website. Although some of the EMDR video resources may not be helpful for you till a little bit down the road, please know that our mindful living coping skills can be accessed at any time for you and your clients, and we like to make those available as our free gift to you. Thank you very much for listening in. Again, this is Dr. Jamie Marich, and wherever you go on your training journey as a trauma-informed, trauma-focused therapist, we wish you the best.